Hello, my name's Adam. I started become a service user with the North Staffordshire Combined Healthcare Trust around 2010, but my journey started a long time before that, in all honesty. My parents separated when I was 16, and it had quite a drastic effect on my life. I know it's not an unusual thing to happen for people to separate, but it was like my whole world came crashing in around me. And the first time I felt sadness in my life, that sort of sadness, I got to 2001, and it was like everything that pushed down in my subconscious had started to resurface again. And I started to feel anxious and depressed, and I was having panic attacks, and I admitted I got a problem to myself. I called the Samaritans actually first, and they told me there was no problem. They told me just go and see your GP, which I did. And he prescribed me some antidepressants, which helped me. I met a girl and we started dating. And it brought happiness back into my life. I thought, well, everything's going well. I'll come off the medication, which I did, but the relationship did end. And I took it. She finished the relationship, and I took it to heart. It was a real tough time. I just didn't want any sadness again, like I'd felt before, and I just thought, I need some help. I went back to the doctor, but this time, instead of him prescribing me with medication, he signposted me to the Healthy Minds in Hanley, which is now called the North Staffordshire and Stoke-on-Trent Wellbeing Service. The lady there was a lovely lady. She made me feel really at ease, reassured me, and everything was okay. I might not have been completely truthful in some of the things I'd said to her. She didn't realise at the time that I might have been suffering from psychosis, and if she had probably told me that I was suffering from that, I probably wouldn't have been able to sort of handle it anyway. I would have probably thought, I haven't got a serious mental health condition like that. I might not have been ready, but I think I was definitely suffering from psychosis then. I had been for years, and it's always made me think that maybe if she'd have picked it up then, how things might have changed been differently for me. But again, it is what it is. She thought I should start Changes Health and Wellbeing down Stoke. I hadn't heard of it. I didn't even know such a place existed. I did pick up some useful ideas about how to deal with my mental health. I learned some of the core concepts. The doctor this time, he'd asked me again, he went through all the questions. I was thinking, what I was feeling and stuff like this. He prescribed me with an antidepressant as well because my mood was low, and it was Prozacs. And for the next sort of 4 or 5 days of taking these Prozacs, I was acting. It just changed my mood completely. I was very manic, overreactive. I wasn't sleeping. I was just bouncing around me flat all the time. We went to the Heartlands. I went with my dad in the car. We were running a little bit late that day. And I can remember there was traffic on the road. I started getting very, very frustrated in the car. And one of the things I used to do to relieve a bit of tension was I used to sort of put my fingers down my throat and spew up and things, which I was hanging out the car window doing this as he was driving along, and he pulled over, and I just said to him, I can't do this today. I started walking back home. My dad carried on to the Heartlands, and he must have told the staff there what had happened. And next minute my phone went, and it was a lady from the Heartlands, and she said, "Where are you?" She says, I said I'm outside some shops. She says, "Wait there, we'll be with you in 2 minutes." And she was true to her word. Within a couple of minutes, the car had turned up, the lady and a man, and they told me to sit in the back, and they basically drove me back to the Heartlands, and this was the first time I thought, I've got a real chance here now. I've got people that that care for me, they care enough to come and pick me up off the streets. And I thought, I've got, I can't mess this up. I'm going to have to start really thinking about my mental health now and my behaviour and things. I thought, I'll never forget that. We got to the Heartlands, we weren't in the waiting room long. They summoned us in to see the doctor, the psychiatrist. She was a lovely lady, and she diagnosed me as being bipolar, which again it was a hard pill to swallow, to be honest with you, because I knew I'd got a serious mental condition. Now I'd heard about bipolar, and I knew it wasn't anything to be taken lightly. They advised me to have to be advised from the home treatment team. One of the negatives I would take from what happened with the home treatment team is that I was having all different people come round then. I'd have a man and a woman come round, then a couple of women would come round, all different people all the time, and there was sort of an incontinuity with it, like there was no sort of consistency. I was having to repeat myself all the time and retell my story to each, instead of picking up where we left off. Eventually I would get some consistency in my life, because I would meet my care coordinator and she would be in my life for the next couple of years. I would be able to trust her and open up to her about anything that was on my mind. Then she introduced me to the early intervention team, the early intervention psychosis team. She introduced me to an STR worker, my support time recovery worker, and they're ever so caring, and they show compassion as well. I went down to Growthpoint, which is another service in the area. It's a horticultural centre just off Leek Road, where it's not many people know where it is. Again, it's for people that are suffering with mental health conditions. It allows people that are practical, like I was with my last job. It allows you to work together to complete tasks. It was one of my goals to get back to work. Every time I thought about work, I felt guilty that I wasn't at work. But Growthpoint was that, give you that confidence that, look, I have got this mental health condition, but I can work with people. We can complete tasks together, and it just reassured you that one day I can get back to work. My care coordinator knew the problems I wanted to get back to work, and she introduced me to the Step On team, which I hadn't heard about up until that point. I wasn't ready for the employment specialist at that point, but what she did do was she said that she offered me the help of a peer support worker. Again, I wasn't sure what it was all about, but basically the peer support worker is there to help you those initial steps to get your work ready, and they like the hope and inspiration of the trust, really, because they're people that have got lived experience of mental health themselves, and they can empathise with you, and that's what people like myself wanted. It was somebody that I could talk to that had similar problems as myself, but had now recovered and was now back at work. He knew that I'd been going to Changes, and he thought that maybe we could find some voluntary work at Changes. So I started to do the peer support groups, and I haven't looked back since. I completed the qualification, and now I am supporting people with voluntary work at Changes, and it's been a very positive experience for me working with the early intervention team and Step On. It's helped me to sort of change my life around, and to realise that from a negative I've turned it into a positive. I have got that lived experience now that's a valuable commodity, actually, and it's very useful when helping people. It got me thinking that maybe I've got something here that I can give something back to the service that has helped me. Well, that's what I was doing at Changes, and then my care coordinator told me that there might be jobs coming up at the trust for peer support workers, and it was just like an epiphany sort of moment, really. I just thought, yeah, it just felt so right. I hope to be able to inspire somebody now to to get back to work, because I realise how it is such it is a real goal for many people. I think that my parents should have been had the option of being a part of the process. I think they should have been given regular feedback, basically, of my progress, or if I wasn't making progress. The recovery started basically when I got the diagnosis from the Heartlands, and I got given a care coordinator and an STR worker. That was what made the difference. It was people that I'd form a close relationship with, that I would be able to trust. The social inclusion that happened with the early intervention team got me through them dark times. Also, the step-on service. I just think it's a brilliant service. I'm now working alongside my employment specialist. We've been applying for jobs of late, and she's helped me no end with interview preparation and application forms, and yeah, I'm very optimistic about the future. I would just like to thank my care coordinator, Sarah. I would like to thank my SDR worker, Steve, and I'd like to thank another care coordinator, Pam. I'd like to thank my employment specialist, Maria, and my peer support worker, Chris, for all the help they've given me. It's been very positive throughout. One of the things I will say about what's helped me with the North Staff's Combined Trust and all the different services I've talked about is that you're surrounding yourself with people that are aware of these different mental health problems and the symptoms. Sometimes your friends don't want to listen to your problems with mental health. They've got other things going on in their lives. They might not have mental health problems themselves. But these healthcare professionals are serious about what they do, and they're just there to help you. It's just wonderful. I would like to ask the board if there's any follow-up service to somebody like me that has been discharged from the services. Is there something in place to see how I'm getting on in my life? I know Step On will give me in work support. I'm just wondering if there's any other service available to see how I'm getting on in my personal life. I'd also like to ask them if they thought that an adequate amount of care was given through lockdown, particularly with new people coming to the services.